Hello, everyone, and welcome. My name is Caitlin Flood, and I am a Senior Program Manager on the National Training and Technical Assistance Team at the Center for Court Innovation. I have the privilege of being here today with an esteemed group of community court leaders who will be speaking about effective responses to homelessness in their jurisdictions. Joining us today is Francis Adewale, Public Defender in Spokane Community Court in Spokane, Washington. Judge Tammy Riggs, a former judge of the Reno Municipal Community Court in Reno, Nevada, and now judge of Nevada's 2nd Judicial District. Judge Mary Kreber Varipapa, presiding judge of Orange County Collaborative Courts in Orange County, California, and Kelly Mulligan Brown, project director of Newark Community Solutions in Newark, New Jersey. Each of our speakers today has contributed to the important work and connecting individuals coming through their courts to opportunities for stable housing and supportive services that ensure housing placement is sustainable. We're excited to be here with you all today and learn from your insights. Our audience members will have the opportunity to pose questions with time for our panelists to respond. A little bit of additional background on our topic today. We know people experiencing homelessness and housing insecurity face many barriers to accessing services, ranging from lack of health care and health insurance to lack of transportation and limited communication resources, whether it be a phone or a stable address to receive mail. These barriers persist and are exacerbated for the homeless and housing insecure population who become justice involved. Today, we'd like to learn from you all about how you're using the community court model to meet the unique but varied needs of this population in collaboration with service providers and other stakeholders. We'd like to start by having you each give a little background on homelessness in your communities and how each of your courts have traditionally addressed justice-involved participants who face housing insecurity. So Judge Kreber Varipapa, if you could start us off by providing some background on Orange County Collaborative Court's response to homelessness.
Thank you very much. So Orange County is situated as a large county, very suburban and yet sprawled out as far as services. So it is a 3.1 million person population. And it's unique in some ways compared to our other presenters in their areas in that it's a beach community, a lot of beach communities and weather specific issues that we have are different than you're going to see in New York or in Spokane. And access to those services is very difficult, both by transportation and because everything is not in a unique, or in a centralized location, it's been difficult for our population. So that's the setting for Orange County. Our response pre-COVID was to have a community court that centralized not just the courthouse itself, which was specific for community courts, but all of the providers then would also come to the court. So the courthouse became the center both for client contact as well as provider contact for the entire county. And that has been, a very, very effective pre-COVID way to have a location where it's an open courthouse. You don't have to be on calendar to come into the courthouse. And the providers are there literally waiting for you. And also in each calendar that we have, unique providers will come in for that calendar. So it's the best of both of those worlds. And that is the basic outline for our pre-COVID response, at least justice-involved response for homelessness.
Thank you, Judge. Francis, we'll turn to you next.
Thank you, Caitlin. I appreciate that. Spokane is the largest city between Seattle and Minneapolis. You're looking at a landmass that covers 3 states. So you have to go, if you set out in Seattle, you have to go 3 other states before you can get a city the size of Spokane. But the Spokane metropolitan area is about 350,000 population. Majority of the homeless population we have in Spokane are not just people traveling down. There are also people that have lived there a long time. But majority of our homeless population in community court in Spokane are indigents. They are all below the federal poverty guidelines. They fall on hard times. They are struggling with all kinds of issues, some medical, some mental, and they have, because our city also is a magnet for tourism, because there's a river, Spokane River runs through our city. So we have a lot of tourists from Canada that comes down just to spend a few days with us and everything. So our business district is like a magnet for a lot of people. And so a lot of homeless populations, you know, and because the businesses are very concerned about this, in actual fact, that's why we attract a lot of interest from our business districts. They actually invest in community court. We have a partnership with our business communities because they see the need that we provide. So our homeless population is really the people that a lot of people have given up on. The ones that are struggling from one, they don't know where they're going to get the next meal. This is why we are one of the first community court in the nation that actually provide lunch when you show up for court. And this is also why we are one of the first community court that is located in, actually the first one to be located at our downtown library. Because when it's very hot, people go to the library to enjoy air condition. When it's very cold, Spokane is very cold right now. There is snow all over the place. And so people go to the library. Now, our library is going through some changes, some renovations. So we are using our city hall currently. So it's right down smack in the middle of the city, because that's where people congregate. And so the kind of people that we find, participants that we get in community court, there are people that are struggling. Rarely do we see tourists, people that are just stuck in our town. They've lived there a long time and they are fallen hard times. And so, they are the people that we want to help. And so, and we have vets. We have vets, Vietnam vets, Korean vets, that have fought through hard times. Our community court is different from our veterans court. We also have a veterans court, uniquely for veterans that are able to do a lot of things by themselves. But the veterans that we have in community court, they are those ones that are going through severe mental health and co-occurring problem that are not able to do a lot of things that ordinarily people, other people are able to do without even thinking about it. So they need a lot of case management. They need a lot of hand holding to be able to get from one place to the other for their health, for their nutrition, and most importantly for housing. So these are the challenges we had during, before COVID. Mm-hmm. But, it's a different thing entirely now. So
absolutely. And we'll love to hear more about Spokane Community Court response during COVID. Thank you so much, Francis. We'll turn now to Judge Riggs.
I wanted to say hello to everybody from Reno, Nevada. Reno is a medium-sized city, and we're approximately 250,000 population. We are located very close, within 10 miles of the California border, right on the Interstate 80 corridor. So much like Spokane, we see a lot of incoming traffic or through traffic, people on their way to the California dream. And for whatever reason, they get off the train, or they jump out of a car, or they get off the bus in downtown Reno, Nevada. Reno is a place that is going and has been going through a lot of change in the past 20, really the past 30 years. People think of Reno and they think of casino gaming, usually. Casino gaming has sort of diversified, it sort of spread around the country after first it began with Indian gaming, which was opened up in the 80s or became legalized in the 80s. For us, that meant that Indian-run casinos began opening up in Northern California and taking that Northern California local traffic. But then, of course, other states began opening their own casinos, and business in Reno really dropped off. So a real diversification attempt happened among the business community. It's been slow going, especially after the 2008 recession, but technology discovered us, and Tesla came in 2015, bringing a lot of other tech companies. Panasonic came in with their giant battery factory. We have Apple, Switch, a lot of big companies coming in, drawing in not only people with high tech experience, but a manufacturing base, so that we have people coming in from all over the country seeking work. A lot of people coming and not finding it, and then ending up in Reno with no place else to go. What is also happening at the same time, and as a result of this influx, is that, you know, we have, like a lot of communities, a shortage of affordable housing. And so existing property owners are able to increase their rents, push out the people who can afford to pay less. And in addition, our traditional housing of last resort, which have been the older motel properties, are being razed to the ground and being redeveloped as either student housing or workforce housing. That has put a lot of people out onto the street. So not only do we have a lot of people who have been here, lived here for a long time, who are having home or housing insecurity, we're also having an influx of people who are also having issues finding housing. And of course, when people come in, or when people start losing their housing, as you all know, it's a domino effect. I mean, there's causes and effects of homelessness. We have all the same problems every other community has. We have people having health issues, access to healthcare issues, drug addiction issues, alcohol addiction issues. Of course, we're a 24-hour town. So anybody can walk into a casino at any time and buy a drink. We also, in the same area, have at least 20 packaged liquor stores. And when I talk about our downtown area, I'm talking about an area of 1 square mile. Within this 1 square mile, we have most of our casino resorts, which make up the majority of the businesses, and businesses that tend to accompany that, restaurants, pawn shops, all the sort of small business that you would expect to see in an entertainment district. We also have a homeless shelter, our only homeless shelter, that is within 2 blocks of that area, as well as our train and our bus stations. So not surprisingly, and the river, our river is down there as well, the riverfront district. So not surprisingly, we have a high concentration of people who are either housing insecure or people who are drug seeking, that sort of thing, down in that area. Now, of course, there's a lot of pressure among local authorities to do something about it, as most of you have probably heard. Really what it seems that the community wants is for these people to go somewhere else. Well, there is really nowhere else to go. Of course, the answer is that we need to start assisting them in solving the issues that are either driving them to homelessness or keeping them down. So our model arose out of the Spokane model. We actually went and visited the Spokane Community Court before we began ours, and also found that our local library was the best place to have our court. Our library happens to have an auditorium inside that we were able to use for our courtroom, and lots of space for which our providers can use and have contact with the people who, the participants who come into community court. And those participants already feel comfortable coming to the library because it is a place where they are able to, get in, out of either the cold or the heat, access computers, be able to sit peacefully without somebody trying to move them along. And it came with the benefit also of a library staff who are already used to assisting and communicating with this group, so they felt safe, secure, and respected in this spot. So it was definitely a bonus for us to be able to access the Washoe County Library for our court. And so that's where we started.
Great, thank you, Judge Riggs. And Kelly.
At Newark Community Solutions, which is a community court program in Newark, New Jersey. It's embedded in the Newark Municipal Courthouse, Newark being New Jersey's largest city and the municipal court being its highest volume court in the state. So we service the entire city with low-level offending being kind of the primary, low-level criminal offending being kind of the primary cases that we see in our court. So that's everything from low-level drug cases, theft, shoplifting, prostitution. On an average year, this year excluded, we usually see over 1,000 clients coming in our doors, and around 20% of that annually are clients who report homelessness within the last year. Because this is self-report, we're pretty sure that this is underreported annually. Homelessness is a pretty significant issue in the city of Newark, as it is for a lot of big cities. What we're seeing too with our population is not only are these folks coming in our doors and having significant issues around housing, their other needs are very complex. This population often has significant challenges with compliance just because of the nature of their lifestyle. A lot of the people we're seeing residing on street and not in shelters. There's interwoven issues of mental health, substance abuse, and pretty significant medical needs as well. And then what we're also seeing is a population of people who have usually the lowest level of offenses. So a lot of individuals, highest level need, coming in with, sometimes even municipal tickets, not crimes. So quality of life crimes around trespass issues, sometimes drug possession, but a lot of very low, multiple incidences, but low offending. So this population really isn't with us very long. So we may have somebody who has the highest level needs who's only with us for a 2 to 3 day mandate. So it doesn't leave us much time or much room to work with the population. When we do, and they do come in our doors, pre-COVID times, we were doing everything we could to kind of help the individuals wade through some of the bureaucracy that has kept them from getting treatment or getting linked with housing in the past. So we might be finding, calling out of state to find birth certificates, trying to get people photo IDs, trying to get people down to the welfare office so they could potentially get the voucher that would get them placed on the list for housing. A lot of the people that we worked with had previous bad experiences at some of the shelters and throughout the shelter system in Newark, so didn't want to go back to shelters, felt safer living on street or at Newark Penn Station, which a lot of people recognize in our city as the de facto homeless shelter for the population that we work with. In fact, in the months leading up to the pandemic, members of our staff from Newark Community Solutions had been working with a lot of different members of the community, both different city agencies, our law department, our various police departments, Newark Police, New Jersey Transit Police, to try to find a new approach to addressing the homeless issue at Penn Station. And all of the things that we were discussing were around, trying to get assistance for this population, but also, the undercurrent of the issue around the public perception of homelessness at Penn Station as people were coming in and out for work and how that impacts the city and the perceptions of the city. So we were working towards trying to figure out how to best assist this population and address their legal needs and get them linked with services. And I can tell you it was several months of meetings that were going on that, we were having, knowing that this was probably the most difficult population to serve, we were really kind of sometimes even going in circles, trying to figure out how best to serve the population. And really those meetings kind of bumped right up into the pandemic. So, we'll discuss in a little bit where we are now as opposed to then, but it's been a really challenging population for us to work with consistently over the years because of the nature of, the complexity of the needs that they have.
Thank you, Kelly. And thank you all for giving us that really helpful context for the populations that you're serving. So, we know that there are challenges to working with any justice-involved population, even if those individuals are coming into the court with lower level offenses. But what are some of the unique challenges and opportunities in working with individuals experiencing homelessness? And how have these challenges and opportunities been impacted by COVID-19? We're going to start with Francis, and if you could talk a little bit about the challenges and opportunities around responding to eviction moratoria being lifted in the coming weeks and months in light of COVID.
Yeah, thank you, Caitlin. The eviction moratorium keeps me up at night. I'm really, really worried about it. And I'm the chair of Access to Justice Board for the state of Washington. So I get to talk to civil legal aid attorneys all over our state about this challenge. I get to talk to the director of our Office of Civil Legal Aid in our states. Constantly, I'm asking for information because I dread the day when this moratorium will be over. And there will be a deluge of community court participants and without any way to go. And all of a sudden, that's a challenge that I can't just, every time, but all we can do is to continue to have a conversation. I'm one of the advocates for extending it. Every time it comes off for renewal, I'm constantly making calls and talking to everyone. This get renewed. At least not, especially when you look at the unemployment number. It's still very, very high. And there is no way we can do it in this nation. We can do, virtually everyone within the lower middle class are going to fall into this place if care is not taken. And, and there doesn't appear to be a solution from Congress. So every time they throw things at us in the justice system to solve problems that we didn't create. So it's time for us to speak up. And I think everyone listening to this, I'm asking you to speak up. But there is another challenge that really I talked about last night. So, and I'm going to illustrate it with the story of one of our participants. He had been homeless for close to 15 or 18 years, actually around more than 18 years, actually, for a long time. He's a Vietnam War veteran. And he's been on the street for a long time because he lost everything. He lost his family. He had no contact with his family. And so we started working with him to get him housed. And, we've been in the system for 7 years. It took us almost 6.5 years to get him finally housed. We got him housed, and luckily for us, where we got him housed happened to be the same street where he lost contact with his daughter. And he was walking on the street one day and he coming out of his house and he saw his daughter and they got reunited. And it was such a pleasant, joyful thing. And so everyone was happy. The daughter was so excited about this. And they spent 6 months together. Now, why did it take so long? Why did it take almost 6.5 years to get him out? Because he has criminal record. Landlord don't want to rent to the type of people that have criminal history. He has a reckless burning on his record. He has all kinds of charges, trespass. Landlord can use trespass charges on your record. So those are the challenges that we face. So he got housed. And 6 months after he got housed, I got a call from his daughter. Francis, my dad told me that I need, if anybody were to attend his funeral, you are supposed to be at his funeral. He died yesterday, and he wanted to be at his funeral. I was heartbroken. I was completely devastated that we took all this effort, got this person housed 6 months, and then he died. And as I was sobbing and crying, his daughter pulled me aside and gave me a hug. She said, Francis, you know what? What you guys did made a difference. I spent the last 6 months, that last 6 months I spent with my dad is a lifetime. I could not have got that 6 months, but for the work that you guys did. And so it got me thinking about how much it meant to get people housed, how much the barriers to housing discrimination is actually affecting not just the person going through homelessness, but the entire family nucleus is affected, is impacted by it. So that challenge is something that, now I work with our Housing and Human Services Department. I review, RFPs for housing placement because of that challenge, because I don't want to have to wait 6.5 years before I get an homeless person housed. Thank you, Caitlin.
Thank you for sharing that, Francis. And certainly goes to show the stability and security that housing provides, not only, like you said, to the individual, but to their loved ones who are also benefiting from that stability. So thank you. Judge Riggs, if we could turn it to you to talk about a challenge also around culture, but more how law enforcement and others in the community first were responding to the work you all were doing at the Reno Community Court.
Sure. Well, one of the big issues that we had to tackle at the very beginning of the implementation of community court is sort of shifting hearts and minds about the whole concept. And, I know that we all know that problem-solving courts have been around a long time. In fact, our adult drug court was one of the first in the nation at the Second Judicial District Court. Of course, I'm at Reno Municipal Court. We are a court of limited jurisdiction. We handle misdemeanor crimes that are committed in the city of Reno, and the police officers who issue either a citation or who arrest on those crimes are Reno police officers. And of course, they are the boots on the ground. They are the people who deal day in, day out, hour in, hour out with the population of homeless persons, which I indicated earlier is increasing in downtown Reno. And much like Kelly indicated with her jurisdiction, public perception is a huge thing. And so the people who are feeling the pressure to do something mostly are the police officers. And so from their perspective, what they do is they either issue a citation to someone, say, let's call it trespassing. And that is what our court, the community court in Reno, handles, low-level, non-violent misdemeanors. So the kinds of crimes that we handle are trespassing, open containers of alcohol, some camping cases. Of course, we run into the city of Boise case. The police are not allowed to issue either citations or arrest on activity that is considered life-sustaining if there's no other place for that person to conduct that activity, such as sleeping out in public on evenings when the homeless shelter doesn't have room. The low-level crimes are what we handle, again, as Kelly indicated, with a high impact on our community and the police feeling the pressure on that. So what they see and what they feel is that, okay, well, I've either arrested this person or just put them or arrested them on a warrant or directly on the charge, and I see them out on the street the next day. Well, of course, because it's a misdemeanor crime, it's not appropriate to, hold someone on those charges for an extended length of time, or to sentence them to anything more than time served, which is used to be the usual sentence. So there's this dual issue of it being a minor crime that we're working with, and people wanting a large punishment, including the police who know the law. So changing their attitudes about working with us on a problem-solving model was a challenge, mostly just due to the culture and the frustration that they were experiencing. So we were able to do that. Over time, we had the street officers, the bike team come in and see what was going on. They were able to work with us as far as giving us background information on some of our participants. They were able to see incremental progress in our participants' compliance with their orders, but they were also able to humanize the members of this population. That is, along with what Francis was saying, that's the difficult part, is that people want to kick down. And who is down further than homeless people? They are an easy target. When you see a group of homeless people or a couple homeless people or someone sitting on the sidewalk, it's easy to blame them for whatever's going wrong in this particular neighborhood. It's, of course, homelessness is not the problem that we're suffering. It's the community, is like an organism. There's a lot of things going wrong that could be going wrong at once if an economy is in downturn, and that is, not so much cause as an effect. But getting not only the community but also the police officers to work with us was our initial challenge. As far as the effect of COVID, I have to tell y'all, I suffered at the beginning of this from a lack of imagination on how long this was going to go on. I really admire the courts who were able to power through and find solutions pretty quickly. Our model relies on almost literal hands-on contact with our participants. After they go through their risk assessment or their risk and needs assessment, we literally guide them to where our providers are and to each of the providers that their risk assessment has indicated they need to contact in order to get assistance. And then they come into the court, and we have, in fact, same-day community service. Same-day community service. We also, again, adopted from the Spokane model, we also have lunch available, which is provided, by the way, by our Washoe County Detention Facility, because we save them so much in housing costs that they're happy to provide that service for us. So, switching now to a remote model has been a challenge. And in addition to finding space, because at the same time, our courthouse closed down, our libraries closed down and have not reopened. So we have found space in our in that same homeless shelter that I've been referring to. They're actually moving some of the women and children out of that shelter into new space. So that space is opened up serendipitously for us to use for the community court, and we'll be getting back on board in a couple weeks. But I tell you, nobody's more surprised than me that it took this long to get us back on board.
Thank you for sharing that, Judge Riggs. And Judge Kreber Varipapa, if we can turn to you about some challenges you and your court program has faced in working with this population, but also some of the opportunities that you see coming out of this.
Our situation, I think, in some ways is so different from the other community courts, at least here as the presenters, in that I do have about 800 people coming just in my court and just under my, just for me as a judge. So I have other collaborative courts in other locations, but with that 800 people, I do handle really serious felony strike offenses, people who have been institutionalized in state prison. I specialize in the high-risk offenders. In fact, and it was a choice, because when our county went out and looked at who our homeless population was, we realized it wasn't just the down and just the people that were one step away or those that just had a stroke of bad luck. That was hugely part of the population. But there was other parts of the population that we had to kind of identify and then figure out how the courts could address, because our population, our homeless population, we had parolees out there, we had probationers out there, and our homeless population was getting victimized by these really serious criminogenic, type behavior that was happening. And so we responded to that by having collaborative courts that dealt specifically with the high-risk offenders. And in some ways, it became, the more the courts were involved, the courts should be involved on those that are very it's very much necessary based on their charges. But in some ways, we have changed how we are looking at the other population, in that we don't want to make them, we don't want them in the criminal system, right? So part of where we were moving is we need them to have as many services, but we as a court didn't want to be the center of that. And I think that's a very different position to take as a collaborative court. So it really went from, I want to be more involved in the high risk criminal end, and I want to be supportive to providers in the lower risk offenders and those that really need services. In fact, we were making these efforts to really support the providers. So we will support the providers first and give them, it makes the homeless population go to the provider, and then that provider says, I can get rid of those tickets, I can get rid of this, and we use these resources here. We will take this to the court, we will take this to the public defender. And so when COVID came, we really changed our model. We had to, and we were able, because we had to keep the supervision level of our high risk offenders. There was no option. I needed probation on there. I needed to make sure the co-occurring courts were getting treatment. And so we literally within days transformed our entire court process to teams, and we kept staffing. I don't think we missed a day. And then as a result of that, as the courts closed down and all of our courts closed down, our teams continued to meet and staff remotely. We continued to problem solve, and it was something that we were doing with all the stakeholders. So every stakeholder had to, we were adjusting to, we were saying this yesterday, that we were adjusting to my attorneys are now appearing in their cars, they're appearing on their cell phones, and I don't think we're ever going to go back. I really think that some of the barriers that we had prior to COVID have really changed, including access to the jail, including access to technology, including access to our participants. And one of the biggest challenges that we have faced is, how do we give access to the courts to our participants, and what does that look like? And so the model that we changed to is this. We changed from it all being about the courthouse and the location and the centralized location where services are provided, to going to the providers in either the shelters and or the communities, the police departments, the public defender's office, the caseworkers, anyone that we knew had contact. We started giving them the ability remotely to come into court. So you couldn't give the homeless population new cell phones, but we could allow the providers to use whatever equipment they had to then have their court appearance from whatever location they were in. So we moved from that centralized to this, wherever they need to be, I can now appear as a judge anywhere in this county, which actually in some ways has reduced the need for transportation. It reduces the need to tromp over to court. It reduces the need to leave whatever temporary job they have. And so we're starting to see this highly effective communication and this new reliance on the providers, which is what I want to see. I don't necessarily think in our county that we want it to be the court lifting this entire weight, because if we do and we take that job over, then it becomes less stable. If I have all the providers then knowing that they can have access to the court, I have now empowered those providers to give court access to people that they're in contact with. So now and I have like 58 police agencies. And so I'm a countywide court, which is very different. So I handle the entire county in some ways a more centralized way, because it's still coming just from this courthouse and just from a handful of judges, but I'm accessing my entire county in a way that I never dreamed was possible. So, that's, I think, for us, a huge shift. And it's a huge positive shift. And I do not think that we'll ever go back to lack of access to court by way of, whatever virtual platform we can. So, and now we're seeing the shift. Healthcare agency for the county has full access to our courts, and they have the tech equipment. Police agencies use their tech equipment. The public defender's office caseworkers use their tech equipment. So all a person has to do if they're homeless and needs that justice involved piece to be resolved is to go through their provider, which means the providers are having more contact. So we're doing some of the things. We're now opening so many of those shelters. We're opening new housing for COVID positive. We're taking over all of those, hotels, motels, which I think was something my colleagues in their counties were doing long ago. This for us is a shift, and I think it's going to be in some ways a hugely positive shift, because again, it's breaking down old systems, old barriers, and reevaluating where the court involvement is, I think, is important, because we get stuck in, the drug court model or this model. And I have to say, I very much enjoy listening and knowing what my colleagues are doing, because it just makes us keep thinking about what we can change, what we should be changing, how we're looking at this, how we should be looking at it differently, and keeping us in that position is, I think, really, really important to deal with the changing population. So.
Thank you, Judge. And we'll certainly do somewhat of a deeper dive into all of the court's relationships with providers and what providers are contributing to responding to this population facing housing insecurity. So thanks for starting us off on that. And then Kelly, if you wanted to talk a little bit about the challenges around helping navigate individuals that are facing these outstanding legal matters while also trying to secure housing.
It's interesting listening to Judge Kreber, Varipapa. I think you're at different coasts, but you're going to hear in much different weather. Trust me, today, much different weather. But you're going to hear a lot of similarities, I think, in some of the really interesting journey, we've taken over the last few months. I mean, I talked about the challenges we had faced pre-COVID with this population, really a lot of them being resistant to get into the existing shelter system or had used up their ability to do it, were no longer able. When COVID hit in New Jersey, Newark determined that they would start renting out hotels as well for the homeless population. So they did a really kind of robust testing system. So they had a population of individuals who had tested positive for COVID were going to one converted hotel and were being case managed by the health department. And then a second population of COVID negative homeless residents who were moved into another hotel near the airport, and they would be case managed by another entity, the Salvation Army. We found pretty quickly that a lot of the individuals who were, for us, we had known for years as some of the most difficult individuals to get off the street and to get into the court space, get into our office for assistance, had agreed to be moved into one of the hotels. So this already was really, really interesting to us, and I think took a lot of collaborative effort from the on the ground, homeless outreach services, as well as we have an amazing crisis management. I'm getting his title wrong, but an officer who works with New Jersey Transit Police, who just every day is boots on the ground trying to move people into a better position. So now we had these individuals who had previously flat out refused to enter into the shelter system, agreeing to stay in a location where services were being provided, where they were being given meals. So we have that. So that piece, interesting, was something we hadn't thought of happening prior to COVID, and now it presented an opportunity for us. At the same time, like over the summer, as is much of the state of New Jersey, started doing virtual hearings. So we were doing Zoom hearings starting in July, and initially 3 days a week, moved on to 4 days a week. And now for the last few months, we have our standing community court calendar 4 days a week. So we are able to, work with the population of people we had previously been working with, get new cases as new matters are being calendared. But then we also were able to determine, all right, now we have these individuals who are all in one location who were really difficult for us to work with previously. We started working with the Salvation Army there to figure out who may have open matters that are residing at the homeless shelter. And we got agreements from the courts and from, our court director here, our judge, our chief prosecutor and public defender, that we could do remote court sessions from the shelter. So, I described earlier these months and months of convening of meetings with a lot of these same people. And I can tell you the idea of doing remote virtual court was never raised. And now it was not only raised, but 100% agreed upon, to the extent where we are engaged. We're doing this. We've done it, I think at this point, 4 times where we've done hearings from the court, from the shelter. We're seeking additional funding to bring in to make this a more sustainable initiative and a permanent part of our community court calendar. Because I totally agree. I don't think this is going to go away. I don't think the idea of virtual court is going to go away. I think it's always going to be with us at this point, particularly for lower level cases. But I think this is the moment where we have to be proactive about making sure that this opportunity is available to all defendants, and not just defendants who have ready access and good internet connection at home. So this is a real opportunity for us to do that. So, we've been able to do this, like we said, moving forward for the last few months, and we continue to do it. In doing this, we've noted another challenge that, we've always known that open legal matters could be problematic for people who are trying to seek more permanent housing. This has now come full force. So now we're proactively going into the shelter to look for people who have open matters. And the response we got initially was, yeah, we can do that. Oh, also, here's a whole group of people who can't get housing because they flagged for various legal issues. So now we can start engaging and working with that group as well. The new challenge that's presented to us, again, not new in the sense it had been there, but now we're thinking more, I think proactively about it, is that a lot of the people that we see who have open matters in the Newark Municipal Court have matters at various other places across the state. And there's only, Newark Community Solutions was the first community court established in New Jersey. There's a second community court in Jersey City, but that's it. So we're starting to really identify that there needs to be a more cohesive network across the state, so that when we have somebody who has an open matter in Newark, who is homeless, and we're starting to help them get this, old fine from Newark that they have cleared up, that we have something in place where we could, really easily reach out to colleagues across the state to say, he has, $80 that's owed in an old traffic ticket in another city, in another county. So we can really put a system in place that efficiently helps this individual deal with these matters. Because in a lot of cases, not all, but in a lot of cases, these are old matters. And because of them, sometimes in warrant status, it is a significant hindrance to somebody being able to get housing. And we're really uniquely positioned right now to do something about that. And I think it's going to take a lot of collaboration, but I think we have a better idea now of what that needs to be. So I really do think, it's going to be a challenge in and of itself to do it, but we're presented with a really interesting opportunity right now to see how we can look forward. Because again, the idea of virtual courts isn't going away. So I think we need to resolve ourselves to that and figure out how we can most efficiently serve this really, vulnerable population, because we don't want these things being the hindrance to get people linked with permanent sustained housing.
Thank you, Kelly. And some really real challenges that you've all flagged, but also some creative solutions, even in the face of COVID, and how the impact of COVID-19 has weighed especially heavily on this population of individuals facing homelessness. And what's interesting is you've all identified service providers as critical partners within the community to do this work effectively. But even with this consensus, there are interesting and innovative differences in how your models kind of interact with providers as conduits to participant interaction, and whether it's the court or the service provider who has been the central hub of this communication in this new remote setting. So we also know that it's a real challenge in this remote setting. Many individuals facing homelessness do not have access to technology tools, such that virtual participation is difficult. And to address this need, it seems like there's 2 ends of the spectrum that are emerging from your programs. On the one end, it's the service providers facilitating the communication on an iPad or a computer, where providers and participants are present together and connecting with the court team, who is then set up virtually. And at the other end of the spectrum, it seems participants are starting to come back into court in order to address their court hearings. And it's through technology at the court that allows participants to then connect to their medical or mental health providers. So we'll start with Judge Kreber, Varipapa, and then Kelly to outline how this first end of the spectrum, which we'll call like our provider-led engagement, how that is working. And then we'll turn to Francis and Judge Riggs to explain how the alternative, more court-facilitated engagement between providers and participants. So Judge Kreber, Varipapa, we'll start with you.
So back to the model of having 800 people just on my calendar. That reality really changed for us with COVID. The building itself, I can now take in, under our protocols, I can take in about 11 people into the courtroom, which is, it's never going to be the same. And I don't know how long it's going to be before we even get back to seeing more people. So having everything centered in one little building for us was not an option. And so when we turned to this new model, post-COVID model, it was exponential court access, because if I open the court and say I can take 100 people in, even if I do it in categories or in appointment only, I can do so much. But if I have 27 providers at different points in the county, each of which can bring in as many people as possible, I can still and do hold 200, 300 case calendars at any given time. And it's seamless because it's just not one provider that's bringing, an offsite. And it's not one calendar. I have the calendar here. It's still our calendar. But then I can have appointments for, these, Seal Beach Police Department, whoever happens to be a hub of access. So again, and I don't have to limit that. I don't have to limit it to healthcare. I don't have to limit it to the doctor. And at the same time, I can require on this virtual platform all the specialists to be present. So it gives me double access now, because now my doctors are there on the virtual platform. My behavioral health services are there, and those connections are made with our coordinators. So I know that services are being connected. I know there's follow through, and I'm seeing it, like I said, instead of just a 10 or 20 or 100 person access to the courts, I now have thousands. I have thousands of people that can access one court, and the ability to do that in management. It's been tough on my coordinators because their job has completely changed. I mean, managing just the communication, just the attorneys trying to figure out how to handle it. So I've really come to rely on, and I say this just a caveat or just a heads up. I do come from a 20-year history of being a public defender. So I have that perspective, and we do heavily rely on our public defender's office because they are primarily the ones that coordinate with the indigent. So we have really tapped into that. They have added case managers, and we've really gone to them and their ability to go out in the community also. So the public defenders being a big plus. Behavioral health services, another big location. And then lastly, we've really changed our relationship with the bars. I have very little funding because the funding we want to go out to the service providers as well. Mm-hmm. So the Bar Association has joined in with legal aid. They've entered into an MOU. So now they're providing secondary legal services as well. So now I have civil things that are being taken care of, access to civil attorneys if they're coming in. My doctors are there, my healthcare providers, my housing navigators, my peer support. They're all part of this new virtual team. And I have access points that are all over the county. That shift for us is, I think, just like I said, it's exponential access to 4 people in the community and 2 people in the community. So we've taken away the court being the hub, and now we're just the communication point. The hubs become empowering these providers. And the providers anecdotally at this point are coming back saying, now they're coming to us more because they're wanting to get these things resolved. And, you know, each person is coming in with their different issues. So some are co-occurring issues they're working on. Some are coming in with, you know, whatever the housing piece is, well, housing is always going to be a piece, but so that means it doesn't matter what their particular issue is. If I don't have someone that is on that virtual platform at the time, I can have the coordinator call a specialist in right then and there. And the only other thing that I'd like to see happen is I really would like to develop a virtual courthouse. So, and it's not to, it would be access to the public, but it also would give access to the providers so that they could get into the forms and all the necessary things that then could be submitted. So that's my next, I think that's my next big move, is to create a virtual courthouse so that any provider could come in and access anyone that we would need to access. So that's where we are. It's, in some ways I've taken more responsibility. In some ways I've given the real power to engage back to the providers. And I think we're going to see stronger providers. And I do realize when I say this that I come from a county that we are, you know, 20 years into collaborative courts, and we have thriving collaborative courts for all levels of criminogenic, all risk needs, and all acuity levels. And so, you know, that helps because we already have those pre-existing relationships with providers and even with our county officials. We've become so much of a main part of their system that I think we've built on that, and we've been able to rely on that with the COVID issues that have been presented. So that's where we are, and that's kind of the model that we're using.
Thank you, Judge. And Francis, if you wanted to speak a little bit as to the court-led access to providers. So I know we've discussed that it's often participants that are coming into the court in order to be able to get into contact with their providers. If you could talk a little bit how the court has facilitated that.
Yeah, the entry points for participants in Spokane Community Courts is through our validated CCAT needs assessment. So we couldn't go the way Judge Varipapa was talking about, because we won't know, we will be grouping in the dark. We have to do a CCAT needs analysis to first find out what are the needs that this person needs to before we start sending them to the providers. So it was difficult for us during COVID when we were shuttered to be able to do that needs analysis. So we were able to, as soon as we started in August, that was the first thing, the first set of people that came in, we started the needs analysis. And then we told our law enforcement, we want you, when you're on the field, we want you to prioritize the top 10 and the top 20 that you have, that you know on the field are a danger to themselves and a danger to others. What can we do to be able to get them help? So that helped us. The officers were coming back with reports. This is what is going on. And so we were able to get those top 20 quickly to the providers, quickly in to do the needs analysis, which we now use to connect them with services. Now, the entry point, so what we did when we first opened court back up in August is we bought 2 iPads and 2 phones. And we said, okay, you can use this phone and this iPad while you are in court to connect with the providers. Because at that time, even the providers were not seeing people in person. They were not physically meeting with anyone. Everything was virtual. To meet with your doctor is virtual. To meet with your mental health counselor is virtual. To meet with your chemical dependency is virtual. To meet with your housing case manager is virtual. And our participant can't keep a phone for long because they are constantly moving from one shelter to the other. The phone gets lost. So most of the time they come in on a Monday or on a Tuesday when we have court, and the phone and the iPad will be available, and the tablet will be available for them to use to contact the providers to make an arrangement when they need to show up. Now people are opening up. So what we did during that time is that we decided to create a big staffing docket, a staffing meeting with providers. So we created a slot where all our service providers in our 3 courts will come in and provide input with regards to where people are, what they are doing. So when people are showing up for appointment with their clinicians, we give them a pass. You don't get a warrant. You don't, as long as you are meeting with your providers, you will not be in trouble with the court. Those are some of the things that we did to ensure. And then we told our homeless outreach, the city pay to hire homeless outreach. When they go out, we also tell them, if you find this person, they are missing the appointment here, they're missing. So we send word out, and that has helped us to be able to get an handle on things. But I tell you, it's very challenging. It's really very challenging during COVID to be able to deal with this population and still be able to provide services, especially when providers are not meeting in person. So that's our experience.
Thank you, Francis. And certainly I think we could agree, I know all of the challenges faced, but it's really inspiring to hear about some of the innovative and creative solutions and workarounds to make sure that you're all still engaging this population in an effective and respectful way to ensure that they're not only being connected for court hearings, but also to their providers that are really keeping their quality of life stable. In our last few moments, we'd like to talk about elevating the feedback of those who have been directly impacted by homelessness. So we're wondering how you've been able to include the voices of those with lived experience, so either formerly or currently homeless, and integrate their insights into your court programming. And Judge Riggs, if it's all right, we'll start with you. If you could talk a little bit about some steps that the community court took to incorporate participant feedback.
We did bring in the University of Nevada's Grant Sawyer Center for Criminal Justice to assess our data, to figure out whether what we were doing is working, whether we are reducing our failure to appears, whether we are improving our recidivism rate. But as part of that process, we also asked them to speak to the actual participants themselves, find out what their impression was of the program, of what how they were treated in our program, with the intention that if the participants feel like they're respected and they feel like this is a worthwhile process, they will return, they'll spread the word, they will come back, get help, and others will also get help. So we did collect that information as part of our data analysis. And as it turned out, the participants do feel respected in our program. They feel like, they feel like they can come somewhere where they don't have, ironically, they don't have a lot of judgment thrown at them. They're not having to defend themselves in our environment. They are here simply to address their problems. And so we were happy that the analysis came out that we were, the participants actually felt like that it was a worthwhile process for them and that they were getting the help that we were trying to give them.
Excellent, thank you. And Kelly, if you could talk a little bit about how the Newark Community Solutions program is trying to incorporate participant voice, especially individuals who are facing housing insecurity, through some type of advisory board.
Sure. So as I mentioned, we're trying to kind of roll this out as a more formalized initiative to be doing virtual remote court from the shelter, but also, expanding that out potentially, as we talked about in the last question, working with other community providers to be able to have calendars set at the other at different social service agencies. So as we're kind of fleshing this out, expanding it more, we realize we're creating something new, at least new to us. So we talked about the idea of maintaining a group of stakeholders, a convening of stakeholders, or an advisory board, and how critical it is that we have somebody with lived experience to contribute to that body, because we want to make sure, as we're making decisions that are going to create policy for us, that they're there to keep, someone's there to keep us in check and make sure that we are actually considering the on the ground struggles of people that are going through this, both pre and post COVID, to make sure that we're making the right decisions moving forward. I also think, you know, again, as we're fleshing this out, we want to be able to have somebody in a position to be what we're referring to as a legal navigator, because not everybody is going to be, you know, traditionally mandated into our program. Some of these individuals are going to see the judge and have things dismissed the same day because they're very old or because somebody's already linked with treatment. So we were considering the idea of having somebody almost like a peer support individual who would work alongside our legal navigator to be the one who's assisting us in going out to the community, going out to different events to recruit people into this initiative, going to the different treatment programs, because it's not always an easy sell to say, please tell us about all the legal things that you have open in your life so we can try to help you. You know, it takes a lot of engagement to be able to get to that point. And I think, you know, our community court has done that. I think to some extent, we've created some culture change within the court system, but you want to make sure that you are continually being proactive about doing that. So I think we need to have people with lived experience who are going to work alongside of us as we are developing this as a, like I said, a more formal initiative.
Thank you, Kelly. And Francis, if you could give us a quick summary of how your program is engaging actual graduates of the community court program and reincorporating their voice and feedback.
Like I said, we have the experience of having to run this court for 7 years now. And one of the things that I'm really grateful to Julius Lang and Brett Taylor that they told us at the very beginning was to encourage us to make sure that the people that go through the programs get to be part of the policy making eventually. And so 3 or 4 years ago, we have one of our graduates actually joined the Downtown Community Advisory Board. I actually did a story call recording with him, and I really enjoy that conversation with him. And so he's now a mentor, and he was a mentor for a long time. And we are looking at having, you know, graduates that have moved on come back as mentors, come back as members of our community advisory board. And in fact, I just sent an email out recently asking our providers to help me look at, because we just started a new third court at our East Central community area, the most diverse neighborhood in Eastern Washington. And so we are looking for a Black and indigenous person to be on the community advisory board of the new court. And it's so important because not as a token, you know, it's not about tokenism, because I know how I'm the first African-American public defender in my office. In fact, I'm the first African-American public defender in the entire justice system. I'm the first. And I opened the doors for other people that look like me. And when you look at it this way. We are 2%, African-American are 2% of the population in Spokane, but we are 15 and 18% in jail. And yet, I am the first Black public defender for the office. And this office has been in existence for more than 30 or 40 years. So we can't run away from the fact that we have to be representative of the people that receive our services. So that to me is one of the challenges that every community court have to look inward and begin to look at replicating in one way or the other. You got to get the voice of those people that went through this experience back to reflect on the court. Thank you.
Thank you, Francis. And a really good point to make and reminder that including individuals who have faced homelessness on a community advisory board is a very real and visceral reminder that these individuals are members of our community. So thank you for sharing that. And with that, we are at our allotted time and we've covered a lot of ground today and are so genuinely grateful for your time, insights, and the hard work that you're doing on the ground every day to improve experiences for justice-involved individuals in your courtrooms. So thank you again for being with us today. Thank you so much. And to the audience, you can see what a team of rock star panelists we have. I don't want to take up too much of your time on the stage, so I'm going to jump right into our first question. And our first question is, are your programs tracking the connection between engagement of individuals with social supports with rates of recidivism? If yes, has there been decreased recidivism noted? And if so, what specific supports or activities by your programs do you attribute this to? So Francis, if we could start with you to talk a little bit about what studies, if any, have been done looking at rates of recidivism.
Yes, the answer is yes, yes, and yes. We have had study done by Washington State University, and we are tracking the rate of recidivism. But I want to say one thing that is very important. If your program is just about 2 years old and you just started, there's going to be a lot of pressure on you to show data of, especially with regard to recidivism. Please resist it, because you cannot really get a good reflection on how well the program is 2 years into it. So we had that pressure on us. And it takes a lot of effort for Judge Logan to say, we are not giving anybody anything until we know we're able to gather enough data. And so the WSU data shows that within 6 months after enrolling in our program, we have a 12% reduction in recidivism. And within 12 months, we have close to 16%. Now, it's very important to point out that this data is made possible because of the work of our social providers that are at the table in community court. It's not because of any law or constitutional changes that we did. It's because we are able to provide services to people that come in to community court. And that is the link that the study shows. And we have these studies available, is available online, and we can always provide it to anyone that needed to look at it and read it. It's a very interesting study because they were able to link this study to the service provisions in community court. And that is very, very important. Thank you, Caitlin.
Thanks so much, Francis. And Judge Riggs, did you want to add anything in terms of work and studies that the Reno Municipal Court has looked at in terms of recidivism rates?
Yes, thank you. And so I just wanted to add that, as I indicated in the presentation, we went to Spokane, our team, implementation team went to Spokane and observed Judge Mary Logan's community court up there, and we're able to sit with Francis and the prosecution team and Judge Logan and ask a lot of questions. And I can say probably the most valuable piece of advice that we got is that you need to collect data, and you need to do it from the very beginning of your program. You need to design that into your program to start collecting data right away. Judge Logan indicated that, they had an idea, the community court team had an idea in Spokane of what kind of data they wanted to collect, and didn't get everything that Western Washington University needed, and so lost some data at the very beginning. So we knew, based on their experience, that we needed to get, as I indicated, the Grant Sawyer Center for Criminal Justice at University of Nevada, Reno involved right away. And it does take some time. It takes some time for them to design their study, to figure out which data they're going to collect, and then, of course, to analyze it. Now, this is something you need to get professional assistance with. You can't try to enter this all in Stata yourself. You just absolutely need a professional entity to collect the data and to analyze it. Now, because of the experience that Spokane had, we were able to get a little bit of a quicker result, and the design was a little bit different. The design compared each member of the group against their prior criminal history for the prior year. So we don't have a percentage of improvement in recidivism that we can report, but we do have a statistically significant improvement over the population. So what that means is that overall, the group recidivated less after their connection with community court than they did without it. And we attribute that to supervision. And, we run the CCAT, the risk assessment at the very beginning. So we know what services they need, and we're able to deploy those day of, on the day, because all of the service providers are there and they can follow up. We do the staffing every week. And so we know who is compliant, who's not, who needs to do community service, who needs somebody to reach out to them, et cetera. So that's a very, very important thing to build in at the very beginning of your program.
Excellent. Thank you, Judge Riggs. And this next question is specifically for Judge Kreber Varipapa. The audience member is saying that they love the idea of participants being able to join virtual courts via community partners like service providers, police, and shelters. That data systems are a barrier in that particular county. And so I was curious to hear a little bit more about how coordinated data sharing works so that all partners can get this information and help get participants in front of a judge virtually.
So I think if I'm hearing the question right, there's an assumption that all providers and all sites of origin that are coming into court have all the same data. And they don't. There are barriers with HIPAA. There are barriers in what we share. So I think you have two different things that we're looking at. One is a point of contact, and then the other is who has what data and how are we sharing that when we get there. So the point of contact, if it's a shelter, if it's the police station, if it's a police officer who is trying to get someone into housing and needs a warrant recalled, and it's individual, they're not always going to have the data. I will tell you that there were a lot of barriers with data sharing that have broken down during COVID, because once COVID hit with us, it was about the participants. These agency data barriers, we just bulldozed them, right? The agencies came around. Healthcare didn't have the right, they weren't able to talk to everyone on video. They had all these requirements within their agencies. We actually took this right in the beginning of COVID, and we just took a meeting and said, look, we're going to lose people. They're going to die, and that's what's going to happen. Fix it. And that was a multi-agency, again, multi-stakeholder coming in, and the data sharing piece is still more complicated, but the immediate HIPAA waivers, about what we could talk about right there, we made provisions right away. I know that's a little vague, and each court is a little specific because some courts are high involvement with medical teams and some courts are not. So the data sharing is, and this kind of loops around to the question before as well as the question I think you just presented, but data sharing is absolutely something our county is working on. We are also working with the state. So if you're in California, California is looking at that as well. So we're trying to see if we can get those data access points, get those matrix as well. So both pieces, and have a shared language. I agree with my colleagues. You get every piece of data you can possibly get from every agency. Make that your number one. How you use that and what you're going to use that for, we'll figure that out later, because we're using that to, again, change everything we're doing now. And it's been helpful to have that conversation even as we have all these multiple stakeholders. So not everyone has all the information just because they're an access point. If it is a data sharing situation, there are, we have waivers, and we have even attorneys signing waivers. So if multiple attorneys are on, we're not going to talk about certain things online. We actually have, this may be the most important tip for this particular answer. We actually have staffing on teams with the attorneys and with agencies and kind of discuss things there, so we know where we're going with things. And then we have full access on WebEx with all participants. So, you know, you've got everybody and their brother coming in on that, and that's open to the public. So that's got its issues too, right? You've got to be careful what you're saying in a public domain like WebEx. So that's how we have kind of the secondary conversations. If we need to have a conversation with specialists, we're doing it in a Teams realm. If we need to have it just with open participants, then we're having it on WebEx. So if that helps.
Great. Yes, thank you, Judge Kreber. And in our last few moments, Kelly, a question for you. Are there specific steps that you and your program at Newark Community Solutions took to kind of change some of the attitudes of important players, or any other good tips about who you kind of invited in or brought to the table early on to learn more about individuals facing homelessness, and any other recommendations you have for the crowd?
Sure. I think, you know, community courts, right? You have to have your initial champions to help get you off the ground and get you up and running. And in the next few years is when you're proving yourself and you're having to bring in more members from the community to develop a larger stakeholder team and bring in new partners. And for us, what was absolutely critical in that process was bringing anybody we plan to work with in any capacity, whether it was a community service provider, a social service agency, the city's welfare office, the new director of the health department, like anybody. They had to come in and witness the process of the community court. We had them come in, do a thorough site visit where they observed the process. All of our calendar days, we would operate 5 days a week, and all of our calendar days would have clients going back before the judge for recall dates, updates about how they're doing. We would have new participants mandated into the program. So that way they could actually see what this looked like in action. They could watch somebody give a testimonial about a success in the program. They could watch what happens if somebody identifies that they're struggling, watch the engagement with the judge, the communication between the judge and the program staff, so they can see how effective this can be and efficient it can be. Because I think a lot of people come to this idea with some preconceived notions about what a community court is. It's either super complicated and way too hard, we probably can't do it in our jurisdiction, or I don't know how this would work, or that it's very soft, right, on the individuals, on the offenders. And I think what they see when they come in to observe it is this is really somebody being held accountable, but in the most humane, respectful way, so that somebody's actually given the option of bettering themselves, which is better for the community, right? We're preaching to the choir here, but for the outside viewer, I think it's really, really important. So, and then after they see that, take them back, let folks meet the judges like ours, like the wonderful judges on this call, pose their questions, their concerns. They can get very in the weeds and specific about their thoughts, issues, and concerns about the partnership. And now they've felt heard, they've seen the process. And then you, for the most part, honestly, once people see it and observe it for themselves, they're in. And then you have to keep having them come back and be a part of the process. It's not just a one-off. These engagements, these relationships are really important. They're living. So you have to make sure that you're continually engaging your partners to make sure that they're still invested in the process.
Thanks so much, Kelly. And thank you to you all. I wish we had more time for additional questions, but we know that we also have several that are coming during this next break from 2:25 to 2:40. So please check out the chat for the different meetups that you can join. And there's a really exciting video montage that you can also check out. So thank you all to our panelists for your insights and all of the feedback that you have for our conference attendees today. And thank you all for joining us today. Everybody take care.